Hey, iPrevent fam. June is Pride Month, and we wanted to do a bit of a deep dive into the history of Pride, HIV and AIDS activism, and its impact on the way society responded to the epidemic. June 28th, 2024 marks the 55th anniversary of the Stonewall Uprising, a pivotal time in American history and the genesis of what we now know as Pride. We celebrate Pride each June for many reasons today. More young people now than ever before identify as LGBTQ. However, people are still attacked, belittled, and harassed for their real or perceived sexual orientation and gender identity. At no time was the discrimination more evident than at the height of the HIV and AIDS epidemic. The HIV and AIDS epidemic has had a profound impact on the LGBTQ community, particularly gay men, since the first cases were reported in the early 1980s. At a time when very little was understood about the disease, HIV spread rapidly and claimed countless lives, fueling discrimination, stigma, and a backlash against the hard-won gains of the LGBTQ rights movement. However, the community's resilience, activism, and pride in the face of this health crisis became linked to the annual celebrations of LGBTQ pride. Gay pride events served as powerful demonstrations of solidarity, remembrance of those lost to AIDS related deaths, and a rallying cry for research, education, and equitable treatment in the fight against HIV and AIDS. The growth of gay pride marches and festivals took on an even greater significance as a response to those who sought to marginalize the LGBTQ community during this traumatic period. HIV and AIDS first made an appearance in the United States around 1970, but it didn't have the public's attention until the 1980s. HIV and AIDS activists, becoming impatient with the government's inaction, decided to take matters into their own hands. In 1987, the AIDS Coalition to Unleash Power, or ACT UP, was formed. Unfortunately, by 1995, HIV was the number one killer of men aged 25 to 44. Thankfully, today, HIV is not the death sentence it once was. Medications such as antiretroviral therapy have been extremely instrumental in helping millions of people live full lives. Unlike the early days of HIV treatment, one pill a day or even an injection every 2 months is now the standard treatment. This medication lowers the viral load in a person's body enough to become undetectable. The viral load refers to the amount of virus in an infected person's blood. Antiretroviral medication, used properly, gets an infected person to an undetectable and untransmittable, or U equals U status. If the virus is undetectable in your body, you cannot transmit HIV. Remember, treatment is prevention. There are 4 different ways that HIV can be spread. Vaginal fluids, semen, blood, and breast milk are ways that the virus can be transmitted. It is important to note that HIV cannot be spread by saliva, sweat, or urine, so you cannot become infected by hugging, kissing, insect bites, or touching. There are a few ways you can protect yourself from contracting the virus. These include proper condom usage, never sharing injection equipment, regular testing, and a medication called PrEP. PrEP stands for pre-exposure prophylaxis. This medication is for individuals who test negative for the virus and would like to have added protection. PrEP works by blocking an enzyme HIV needs to make copies of itself or replicate in your body. If you think you may have recently been exposed to the virus, there is another medication called PEP. PEP stands for post-exposure prophylaxis, meaning it is only effective after a person has been exposed to the virus within the first 48 to 72 hours of the possible exposure. Get to your nearest emergency room and let them know of your potential exposure. Due to the fact that HIV transmits much more easily through anal sex and lack of condom usage, men who have sex with men were disproportionately affected by the virus. The virus was then nicknamed the gay plague or gay cancer, even though gay individuals weren't the only population affected by HIV. They were the ones who withstood the brunt of the backlash. Other individuals who are most at risk of contracting the virus are people who inject drugs and cisgendered Black women. Community organizations, advocates, and allies have played a crucial role in the fight against HIV and AIDS since the beginning of the epidemic. Here are some key ways they have contributed. Raising awareness and education. Organizations like the San Francisco AIDS Foundation, Gay Men's Health Crisis, and ACT UP were instrumental in disseminating information about HIV and AIDS, promoting safe sex practices, and challenging stigma and misinformation surrounding the disease. Providing support services. Community based organizations like Odyssey House Louisiana, Bounce to Zero, Crescent Care, Absolute Care, 504 Health Net, and Gilead have offered vital support services such as counseling and testing. Organizations like NOLA Black Pride promote diversity, equity, and positive change in the New Orleans Black LGBTQ plus community. Fighting discrimination. Groups like Lambda Legal and the ACLU have taken legal action against discrimination against people living with HIV and AIDS in areas such as employment, housing, and healthcare. Mobilizing activism and protest. Groups like the AIDS Coalition to Unleash Power or ACT UP organized high profile protests and civil disobedience action that brought national attention to the AIDS crisis and pushed for a more robust government response. Odyssey House Louisiana implements harm reduction strategies such as safer syringe access for everyone, really, to reduce the spread of HIV among people who inject drugs, and safer sex kits to allow proper condom usage for those who do not have access to condoms and lubricant. In addition, we also provide flavored oral sex condoms called dental dams. A dental dam is a thin layer of latex placed over the genitals or anus before performing oral sex. In conclusion, the HIV and AIDS crisis had a profoundly devastating impact on the LGBTQ plus community, particularly in the earliest years before effective treatments were available. However, the community's response demonstrated incredible resilience, compassion, and activism in the face of terrible suffering and discrimination. From organizations like ACT UP demanding action to events like the AIDS Memorial Quilt allowing for grief and remembrance, the gay pride movement played an essential role in pushing for research, reducing stigma, and supporting those impacted by HIV and AIDS. While we've made incredible strides with medications that can now control HIV as a manageable condition, the legacy of the crisis lingers on. It reminds us to uphold the dignity of all people, fight discrimination in all its forms, and continue making progress through community action and gay pride. I hope you enjoyed our presentation. We absolutely loved putting it together. Don't forget to follow us across the social media platforms at iPrevent_OHL. And please make sure to always live your best authentic life. Thank you.